Hepatitis B Serology Interpretation. Today, we'll be exploring the interpretation of hepatitis B serology. This is a critical topic in clinical medicine, as proper understanding of these markers helps in identifying stages of hepatitis B infection in the body. Let's get started. Let's begin with differentiating between acute and chronic hepatitis B infections. Both have positive hepatitis B surface antigens. That means hepatitis B virus is present in the body, and thus both conditions have negative result for antibodies to it. Both have positive hepatitis B envelope antigens. That means hepatitis B virus is replicating in the body, and thus both conditions have negative result for antibodies to it. So the differentiating point is only hepatitis B core antibody. Acute hepatitis B infections have IgM antibodies, so it is the key marker for acute infection. In contrast, the presence of IgG anti-HBC usually points to a chronic infection. This slide covers two important scenarios: the window period of hepatitis B and the chronic carrier of hepatitis B. The window period refers to a short phase during acute infection, when all markers of hepatitis B have disappeared, except for one. Here, the only reliable marker is hepatitis B core antibody of IgM type. On the other hand, a chronic carrier will typically have persistent hepatitis B surface antigen for more than 6 months. That shows that hepatitis B virus is present in the body for chronic time period, but he will have hepatitis B envelope antibodies. That means that hepatitis B virus is not replicating inside the body. That's why the person is a carrier and not a patient. Since he is a chronic carrier, his hepatitis B core antibody will be IgG type. In individuals who have recovered from hepatitis B, we'll see antibodies to hepatitis B surface antigen and antibodies to hepatitis B core antigen, which are specifically IgG type. These indicate immunity due to natural infection. However, those who have been vaccinated, they will only have antibodies to hepatitis B surface antigen, since the vaccine does not contain core antigens. So there is no development of antibodies to hepatitis B core antigen. This difference is important in evaluating a patient's immune status. To sum up, interpreting hepatitis B serology markers allow us to distinguish between acute, chronic, recovered, and vaccinated states. With practice, this becomes an invaluable tool in clinical decision-making.